Lewis, back to you. It looks like it's about 1 minute before 11, but we are so glad to be back on. It's something I look forward to every day, actually, and I'm glad you guys are joining us. I am always looking for great guest ideas, so if you all have anyone that you want to suggest to me, please do, because it's fun. I'm trying to pick people that represent a variety of persuasions, a variety of talent, skills, and we can just bring them to you. I've got next week all planned. I think you guys are going to really, really enjoy it. A lot of fun, different variety things that we're going to talk about. Hopefully every day will give you something that you can take away and something that will be a tool for you. So I am going to invite today's guest, who is my dear friend. He happens to also be our dentist. He's been our family dentist for a long, long time. And I'm going to see if I can invite him here. There he is. And we are going to Dr. Ed Sa to join me this morning. And we're all kind of new at this, so we're hoping that he can come on. There we go. We're connecting. Ed.
It works.
You did it, my friend.
Yeah, I feel like
You're my brilliant,
right now,
most educated, one of my most educated, talented friends. And here we are together. How are you?
I love
Where
it.
Are you, by the way? Are you in your home office?
Yeah, I'm sitting in my office right now, which is where I've been pretty much most of this whole lockdown, more than anything else, just trying to get educated and also spend time on the practice as well.
So tell us, I always ask, every day I ask my guests, where are you? And you just told us that, but what is going on with your practice right now? Because you basically had to close, right? Like so many others.
Yeah, we received recommendations from the ADA about 2.5 weeks ago, just about in terms of limiting social interaction to be able to start shutting down the practices. And so we went on the recommendation on the ADA early on, and then sure enough, the state recommendation sort of followed along. So we're trying to do our best and try to be cognizant and make sure that we can keep our interactions with patients as limited as possible right now during this time.
So do they allow you, like if someone has an emergency problem, you could go in and treat a patient?
Yeah, in fact, I was there this morning. So in no way, our goal right now is to make sure that we limit as much interaction of the patients going to the hospitals. And so we are allowed to see people on an emergent basis. I think that definition is a little bit loose. But for us right now, if anybody's in pain or discomfort, we want to make sure we take care of them. And I think most offices are doing the same right now.
Yeah, that's actually really helpful because, you don't think about that until you really have an emergency and then you wonder, where do I go and what do I do right now? So, yeah,
it's a unique time. It is a unique time for all of us. I don't think anybody has a playbook or ever, planned out for a situation like this. So,
isn't that the truth? I mean, it's just such uncharted territory.
Yeah, but it is what it is.
I am so glad that you were willing to come on as I sit here talking with these braces that you put me in.
And you look beautiful too.
They do look very nice, all things considered. But I wanted to do this this live with you because I have learned absolutely so much in the last 2 years, really, as we've been talking through some of my issues. And I think a lot of people, you've taught me this, a lot of people have sort of chronic things that they've been dealing with for many, many years, and they would never stop to think that perhaps it's related to the orthodontic work that they had done in their teenage years, which was a lot resulting for me, what I've been dealing with, but also other things like chronic migraines and sinus issues and so many things that you as an innovator and really at the forefront of a lot of this have been discovering. I was reading back, you sent me yesterday, and I want to read this for everybody, what my symptoms were when we first started talking about this. And here is what was on my case. Sporadic hearing loss, congestion, years of congestion, vertigo, chiropractic care that I was going to for neck, shoulder, issues like that, soreness of jaw, scalp pain.
Yeah.
Now,
Yeah.
what was wild about that is that I was getting my hair done one day at my hairdresser, and she's washing my hair, and she's like, "You have a really tight scalp." Now, that's a funny thing to hear, right? You're thinking, how can she even tell? And she's like, "You have a really tight scalp." So that led me to start suspecting things. And then I had neck pain. So now I'm in getting my teeth cleaned with Becky, who's your wonderful person at your office.
Yeah.
And I was just mentioning to her that I had this scalp issues, like pain. In fact, when I was taking a shower, a couple times I thought, I wonder if I literally have like a skin cancer on my scalp, because just touching my scalp would make it sore. And then you all started talking to me about what it could be. And I want you to take it from there.
Yeah, it's fortuitous and serendipitous that you had an opportunity to work with Becky at that time, because Becky dealt with the exact same thing. And so it's interesting. Like we went through a whole series of things, from vertigo to scalp pain to neck, chiropractic care, and pretty certain the topic was about braces. And so,
right.
You know, and I think that's where I think the disconnect has always been in what we're trying to do in dentistry. It's interesting that, especially in this country, like we feel that because of the way education is sort of run, we have medical school, we have dental school. And there's this dichotomy, a separation, where we believe that things that are going on here have no relevance to the rest of the body. And I always tell people that a 5-year-old oftentimes has a better understanding of anatomy and physiology because they sing about it. They have a little song that says the foot bone is connected to the ankle bone, is connected to the knee bone, is connected to the hip bone. A 5-year-old understands everything is connected, but we somehow disassociate everything that we do here to the rest of the head and neck physiology of what's going on in the body. And I think that's what my eyes have been open to. I started this journey in 2002. It wasn't because I had this huge thirst for knowledge. It just happened to be because I was dealing with a lot of aesthetic dentistry cases and cosmetic cases, and realized that some of those cases were becoming symptomatic. Like patients would come in like, "Ed, I love my smile. Thank you so much. But just bear with me. I had this headache." And I'm like, okay. So what started this process for me was I had 2 patients back-to-back on back-to-back days that we had just done work on, and all of a sudden they were getting headaches. And I remember asking them, like, "Do you normally get headaches?" Like, "No." That's when my eyes had to, I started, my interest started getting piqued in terms of trying to figure out what's the relationship between what goes on here versus everything else. And the more and more the technology is sitting out there, the more and more we're delving into the science right now, we're realizing everything here it's all connected. There's nothing that's disassociated. And if you're in medicine, if you're in the science portion, it's hard to connect those things. If you're not inside of it, then it's easier to understand, well, of course that is. I mean, why would you think there is a disconnection? It's because we were always told and taught that we could do whatever we want here and it wouldn't really affect everything else that's going on anywhere else. But heck, even with medicine right now, with the emphasis of what's going on in medicine with sleep apnea and the public awareness of what's going on with apnea, we're realizing there's a strong association, and we've known this for years, just that it's been hard to really get interest beyond really just from, niche little areas in dentistry as to how important what we're trying to do in the head and neck, in the mouth, and what it deals with in basic importance like airway. Your stuff is pretty unique in the fact that there was no clue about on understanding on your side of it. Actually, let me reword that. It's not unique. It's more common that you wouldn't associate those things. We end up going to physicians and neurologists. We go through Botox. We go through medication. We go through other manipulative care, where we keep trying to figure out why am I having this, because it's not healthy. It's not normal. And then you end up not having answers. And I think, again, fortuitous, serendipitous, Providence, you ended up in chair with Becky, where Becky was she's my hygienist, and she's been with me for 17 years. And when we first noticed stuff on her, she had been diagnosing TMJ issues on patients for at least 2 to 3 years.
Wow.
Was talking to them, trying to bring awareness, and yet not until we started her therapy did she realize that the scalp pain was associated to what's going on with her, with her joint and her TMJ.
Amazing.
So, I think, the question mark, especially for people who've known you for years, is why would you go through braces? Because you have a pretty smile. Teeth are straight, and typically we associate braces with basically straightening teeth. Teeth are not crooked. I don't like my smile, or things are not even. So now you go through orthodontic therapy for that reason. And yours was not that reason. It was more systemic, big picture, health oriented stuff that had nothing to do with how straight your teeth were.
Well, and you just said it so perfectly, because and people ask me all the time, where they'll look at me at the grocery store and they'll be like, wow, your teeth are so straight. Yeah. And they were very beautiful and very straight, thanks to you. Very beautiful before I started this. But what was interesting, and anyone that's been my friend for a while realizes that, well, let me get the backstory. When I had braces as a teenager, I was being corrected for an extreme overbite. And it was common back then. And so I went into braces and I wore one of those face bows, and I wore it literally for 20 hours a day. So I spent whatever it was, like 4 years, getting my upper bridge pushed back into place. Okay. So that was all well, good and fine. And nobody knew any better then. My sister had something similar done. And now then, what you did is, as you began to analyze through photography and through muscle tests and everything that you did, and I'm speaking in layman's terms because it was a lot more intense than that. My first mode of treatment was growing my upper bridge out to where it should have been in the first place, where it was. And and the way you explained it to me was, rather than being pushed back as a teenager, I should have had my lower jaw brought out so that there was more natural bite, and it was done the opposite way. Now, fortunately, I did not have teeth pulled. How many people that went into braces in my age group started by getting all their teeth pulled? I mean, you can just see the problems with that. And then another thing that some of my girlfriends will appreciate is, you explained to me, Ed, that this is why so many women now my age are filling their lips with Botox, because when you have your upper bridge pushed back, you can see that all these lips are going down and flattening because your bridge is back too far. So quite honestly, that was not unattractive to me either. I thought, hey, I can maybe eliminate, and it's actually eliminated some of these lines right here, because as the bridge grows out, the face fills in and all your sinuses and everything begin readjusting. It's been absolutely astonishing to me, really.
And I think, I think we, and this is because it's me as a guy, I don't think I understood the power of the aesthetic side of things. I mean, I was focused solely on the physiology, focused solely on making sure that you guys were healthy, that, hey, it'll make you look nicer too. I think I think that power, I underestimated way too much, because women, especially women, you all pay attention to the littlest, slightest changes, and your eyes are so much more attuned, and where most guys were just sort of somewhat clueless. The aesthetic side, most of the stuff that you're seeing in plastics right now, whether it's fillers, Botox, Kybella with, chin tightening and everything else, it's interesting. Once you develop and you position the jaws in the correct physiologic position, things look better too. They look better. But I mean, I get it. I mean, I think, I would love to tell you that even today that we stopped pulling teeth for orthodontic purposes, and it's not true, unfortunately. I think there is a common belief sitting out there that, simply some mouths are too small. And because they're just too small enough space that we can't allot for, all the teeth to be there. And what we've realized over the years is that's not true. And we can develop certain areas. Orthodonts play a very powerful role. I think, for the majority of the people right now, just because there's not an understanding of what's going on here as much, I think teeth straightening is still a powerful tool. And there's still a lot that goes on in terms of health of the bone, health of the teeth, by making sure that they are straight. What we're trying to do with you obviously had nothing to do with straightening with teeth. Your teeth were straight. You had everything positioned. Right now, all this stuff that you're getting resolved, whether it's the neck issues, the vertigo, the scalp pain that you had, those are things that we're focusing on. So when we're done, as far as teeth go, your teeth aren't going to look a lot different. Now, your face, your airway, your jaw position, the comfort, your neck, your posture, those are the things that we're trying to sit there and resolve. And, I think for the most part, we're almost there, and you're almost finished too. So the finish line is somewhere, somewhere close to you. So I know.
Yay,
It's been,
yay.
I know,
What
right?
I won't miss is about the 20 minutes it takes to brush my teeth at night, because I'm obsessive about everything you've told me with my air water pick and all that stuff.
It is nice though, because you do get like a built-in little snack time, like unexpectedly, during the day. All of a sudden you're like, oh, wait a minute, there's part of my lunch again. So, I know.
Yeah, I still have to get over the irritation I have when my husband is like, right there, get it out, get it out. But let me ask you a question, Ed. For those of us, for the others that are watching, what is your philosophy? Is it fair to say that if someone is looking at maybe doing Invisalign or something to really just straighten their bite or remove spaces and all that, what is your philosophy like? When does someone look at something as intense and as long-term as what I've done with going back into braces? And when does someone just go in for what's going to be really more cosmetic?
That's a great point. I don't think there's anybody over the age of like 12 that is coming to us and saying, oh God, please recommend braces, or I'm so glad you mentioned braces. I've been thinking about it my entire life. Oh wait, I can't do Invisalign. I have to do metal. I'm so happy. Like, no one says that. No one thinks that. That's not what they want to do. And, it's not like, anybody I treat, again, over the age of 12 is excited about going into full metal braces. The motivating factor most of the time is going to be, are you dealing with other symptoms that are associated with that jaw? If you're dealing with other symptoms and you're tired of taking medication, you're tired of having to see the chiropractor, you're tired of having to deal with other medical issues to take care of symptoms and not taking care of the cause, then at that point in time, it's worthwhile talking. If after a chiropractic adjustment, the joint is positioned where it needs to be in a healthy position, what's causing you to have to need an adjustment every month or every 2 weeks? Right. Something else is happening that's sitting out there. And so our goal right now is to simply say, let's get to the etiology. If we get to the etiology, and we know before we ever start braces, we know before we ever do anything else, that can we get you to a healthier position? And if we can, then, okay, braces is worth it, because we can go through 2.5 years of inconveniencing ourselves with the braces if we know that the overall health portion of everything is good. I don't think there's an adult that's sitting out there that, whatever age, decides that, hey, I'm just going to do this just to straighten teeth. It's a difficult sell. I mean, if you're going to do that, I strongly recommend going to your orthodontist and just looking at Invisalign. We've offered Invisalign over the years, and so it's not a bad modality at all. You can straighten teeth and still be healthier for it. I think there's a place for it. But I think it's for each person to figure out what's your approach towards healthcare. For us right now, we make the recommendations quite a number of times to a lot of our patients that we feel need it. Does everybody say yes to it? Of course not. And some people, it's not symptomatic enough. It's no different than us dealing with our posture. If the posture is great if we're thinking about it, but if our back doesn't hurt, our neck doesn't hurt, our shoulders don't hurt, nothing hurts, why am I spending all this time? Or why would I go through chiropractic? Why would I go through PT? Why would I go through all this stuff to straighten it if it doesn't hurt, if it's not inconveniencing us? So I don't want to use pain as the indicator of health. But when you start to deal with adult orthodontia and orthodontics, I think at that point in time, the reason why people are going to go through it is because it's a big picture understanding that they don't want to take care of symptoms anymore. They don't want to stop taking meds. They want to be able to sit there and resolve themselves. I have somebody whose husband is a surgeon, and she had been on 3 large, pretty heavy dosage neuromeds, and has been on for a number of years. And so, again, they're in medicine. So, you don't make the assumption that, hey, I can get off of, Imitrex and gabapentin and, just all these different neuromeds if it's not needed. Because for them, it's, it's what I have to live with. It's what I have to deal with the rest of my life. And so it's interesting because within the first after about 9 months of therapy, we're able to get, her off of all of her meds. And so,
wow.
This is somebody who's in medicine. So it's not like, this is commonplace knowledge that's sitting out there. All we know is that, just no shortage of probably 300 to 400 patients in my own practice alone have we been able to take off all their meds. This is just patients they're just on medication alone. So in this day and age, with essential oils sitting out there and everybody getting an understanding that they don't want to put crap into their body that's not natural, it's a big deal to be able to address etiology and not have to worry about taking care of just symptoms the entire time.
It's so true. I remember when I was contemplating this, Katie, who's one of your wonderful people in your office, who was in braces already herself, and she said to me, I have had chronic migraines since I can remember. And she's in her 20s now, and she said within 2 weeks of me starting this treatment, my migraines went away and they have never come back. And she said, I would go to bed 1 or 2 days a week, be completely debilitated, like couldn't get out of bed.
Yeah.
I mean, that's dramatic. Now, my symptoms weren't that, but you know, it's interesting, Ed, and I asked you about this on text the other day. When I would get 1 or 2 really bad colds a year, but invariably every time I would have sinus issues, it would immediately turn into a major sinus infection. I can't remember having a cold for 20 years that did not turn into a sinus infection. I never have had sinus surgery, but I had these issues. So about 2 weeks ago, I come down with a cold, and honestly, right away, I'm like, am I getting corona? You know, I'm like coughing a little bit. I'm wondering. And it turns out it wasn't corona, thank the Lord. But it didn't turn into anything. In about 5 days, I was completely over it. And I've watched my husband have these colds for like 5 days, and he moves on. And I'm like, could this be because now my sinus cavity is actually processing infections and doing what's supposed to be? And what did you tell me?
And it's critical for health. We were designed to be nasal breathers. We were not designed to breathe through our mouth. And yet, heck, we've seen a lot of movies that talk about, oh, I can referring to somebody who isn't as intelligent as, oh, look, they're a mouth breather. And it's that look. And so, you know, it's not the look. I mean, it's also better just to, you know, walk with your mouth closed too. But it's not just a look. It's the physiology. We were designed to be nasal breathers. And as we breathe through our nose, one of the things that we do know is that one of the highest producing, actually one of the almost only producing places where we produce nitric oxide on a routine basis is when you breathe through your nose. So when you breathe through your nose, the hairs in your nose start to fluctuate. As they fluctuate, it produces nitric oxide. Nitric oxide is a great antiviral. In fact, in the middle of everything that's going on with COVID-19 right now, coronavirus, the CDC republished an article that simply said that, you know, nasal breathing is one of the most powerful antivirals that we can have. Natural antiviral, you know, things we can do in our body, and it's that nitric oxide production that's so critical. And, so it's not surprising.
And the fact that you said nitric oxide, I mean, it affects sleep. It affects so many things. My dear husband, you're treating him right now for years and years of sleep issues. And there's just so much that goes into it. And let me ask you this, Ed, how would someone find a dentist? Because not all the dentists and not all orthodontists are approaching it from your philosophy. I know you're really an innovator, and you're part of a group of innovative dentists and orthodontists that are coming into this. How does someone, because we have people watching from all over the country right now, how does someone go and find someone who can consult with them the way that you consult with us?
I think, you know, probably one of the easiest things is get in touch with our office and let me know where you are. Most of the time, I have a pretty strong network of people across the country. In fact, it's not even across the country; it's really around the world of people that are
amazing.
Yeah, that are trained in this. It's not that many. It's newer. I would just say that. So, but I think, you know, the strongest thing that I think the most powerful thing for our patients, what they're realizing is they're doing the investigations and wondering, like, what is this and why isn't everybody doing this? The conviction ourselves is strong enough that we're doing it on ourselves, and we're doing it on our children. I think that's probably where, in fact, almost every child, not almost every child in the practice right now of people, of my employees right now, my team members, they are all being treated right now under this sort of methodology. And it's, again, it's not about straight teeth. And so it's a strong enough conviction that, you know, that we're doing it ourselves, you know, spouses, and then also on our own children. So I think if they get in touch with us right now, to answer your question, I think we can help find, you know, locate some people for them. It depends on where they are located, as to how easy it is. I will tell you that it is not uncommon. In fact, we have a number of patients right now that either fly in or drive 4+ hours a one way to see us to be able to go through all this. It's not the ideal thing, but for them, they're so desperate, and they've been looking for so many different answers for such a long time that it's worth it for them to make the drive. And so, you know, I think there's a way for me to find people that they don't have to make that kind of drive.
That'd be amazing. And what we'll do for everyone that's watching is, on my post today in my feed and in my story, I posted at Supremia Dentistry. That's Ed's practice, but I will have that with our video as well afterwards, so that you can get in touch with Dr. Suh and his team. You know, we're living in New York full time right now. We happen to be in North Carolina because we were here for spring break and decided we better stay put. But smart. I've been having this treatment for the last 2 years, nearly 2 years, and doing it all from New York City, just making my regular appointments, trying to get back here when I can. You've been amazing to work with me, Ed. And it's been a journey. I mean, it was a huge decision as a speaker. I'm using my mouth all the time.
Yeah, that was a big concern, I remember.
I mean, you know what you find though is, and someone said this to me early on, we all have some issue, right? We're all dealing with something.
Isn't that true?
And no one even notices after a little while. I don't even notice it anymore. Although I'm extremely excited that you're telling me maybe by Christmas I'll be done with all this.
That's our goal.
But like you said, you know, to invest 2 years of your life or whatever it takes to correct health problems that you don't want to cope with for the rest of your life, it's worth it. And it's at least worth exploring a bit more. So I just want to thank you for being such a true friend. You've taken care of all of our boys, our entire family for as long as we can remember. Our boys love you. We're all big fans. And now you're treating my little girls. Oh, and Victoria had told me she was going to come. She's down doing school, but she was going to come in. She said, can I show Dr. Suh my teeth? Because they're brushing every night.
Oh my gosh. You might want to be careful because I'm pretty certain there's a high likelihood that some of us might steal them when they come into the office. They're so cute.
Would you want to steal them right now? Because it's
True. Point taken.
It's all good, but thank you, Ed.
Oh, I appreciate the invite.
Being on today, I really, really appreciate it. And if any of you guys have questions, you can DM me or drop us a note. Certainly, you can follow Supremia Dentistry. They're wonderful. You can drop them any kind of direct messages that you have. But here's to a whole generation of kids who won't have the same challenges that we've had, hopefully, because they will find help a lot earlier than most of us have.
Well, thank you, Lynette. I appreciate the opportunity. Love you.
Love you too. Love to Heather. We'll see you guys soon.
Bye, guys.
Bye-bye.